we've just recently went to TV, where we do TV, radio, and podcast. And it's like I said, we're just waiting for Mark to come on. There he is. Voila.
Now I can't hear.
Are you muted? Can you hear? Okay, let's see. Maybe unmute. Let's see if he can read that. Can you hear now?
I'm not seeing the audio.
Okay. Check your volume. Oh, let's see. Folks, this is live. See, this is what happens on a live show. Sometimes everything goes great. Let me see if I can get him to check his volume. Okay, can you hear now?
Okay, if I'm not getting any audio, what should I do?
Let's see. Check your volume. I'm hoping he reads this on the. I wondered if we should have him call in. Juan, let's see if we can write him to call in on his phone by giving him the number. I don't know if he's actually seeing the chat line. I hate for there to be dead space. Okay, let's see if let's put the phone number up there.
Okay.
Can you hear now?
I had to put some or earphones in. Can you hear me?
We hear you fine, Mark.
Good.
Oh, I was just telling everybody that you've been our dental implant expert for 6, 7, 8 months. And when we went to TV, I get this. It's funny because when they said you're going to do TMJ today,
yeah,
we got someone who said, "How come you don't get an expert in TMJ?" I mean, it's amazing, but that's one awesome. Today.
Yeah, that's great.
Mark, first of all, tell everybody about your practice.
Well, my practice, I've been in practice now for about a little over 30 years in kind of west of the Galleria area. And just like any other thing, you start off as a general dentist doing little things, and then you like certain areas. And we've kind of really gravitated to things that we love doing. And one of those is TMJ, and we do just about everything else too.
And I want people to know that we also have you as our expert in sleep apnea too.
Sure. Yeah, we've done a few segments with sleep apnea, and we do a lot of that in our practice.
Well, I got to tell you that our next show next month, you got to talk on dental implants. I'm going to tell you the reason why. I've gotten 8 since we announced the new show on TV. I've gotten 8 emails from people in the Houston area, and I guess Galveston is the Houston area, who want to know about dental implants. So maybe we can do dental implants next time.
Yeah, we'll do that next time for sure.
That will be great.
I'd be happy to.
So, Mark, how do you know?
And you can call me John, by the way.
Why am I saying Mark?
Well, Mark is my middle name, and I get that a lot. But John, I go by John for sure.
And it's Jon, not John. Okay.
Yeah, correct.
Dr. Van Slate, let's talk about TMJ. It has to do with the jaws.
Sure.
And I understand it's very painful.
It can be. Yes, it can.
So how does a person know they have this?
Well, I guess the best way to talk about this is the jaw joint is just this little joint right in front of our ear. And TMJ is short for temporomandibular joint, but that's what we call that. And it's interesting because you can actually feel the joint. If you put your finger right in front of your ear and you open, you can feel the joint moving forward. And as you close, you can feel it moving back. But the unique thing about this joint is that people that have TMJ, it's a very self-diagnosable condition, because in general, people are going to have soreness in their face and in front of their ear. They're going to carry, headaches and just in general have pops and clicks that they can actually audibly hear. But I guess the big thing with TMJ that we see a lot of is that you're going to have a lot of tension headaches that are frequent. You'll have migraines. You can have, because the joint's in front of the ear, you can have earaches, ringing in the ear, a stuffy ear feeling. These people go to ENTs and they go in there and say, hey, nothing's wrong with your ear. It must be a TMJ problem. And of course, the pops and clicks, but people in general just carry a lot of fatigue in their neck and their shoulders, and it can be really severe at times.
What about posture? Does that contribute also?
Well, posture is a big deal and a really big thing that's overlooked with TMJ issues, because when you talk about posture, you think of it like this. If you look on the side, our ear canal should line up with our shoulder. And then if you draw a line through our hips down to our ankle, if our ears are in front of that line, that's forward head posture. And you can imagine if our head is like a bowling ball sitting on top of the head here, that's like a 10-pound ball. For every inch we move forward, it's creating like 10 to 15 pounds per square inch of pressure that puts a lot of strain on the neck and the back and the muscles that support the TMJ joint. So you really cannot resolve a TMJ pain if the posture's wrong. And the weird thing is, we're living at a time where everybody's, having their head down, looking at cell phones and computers.
Yes.
It's just amazing how we're seeing more TMJ issues than we ever have before. So posture's a big deal.
John, I have to do this. Sometimes as a host, I've been doing this for 10 years. You don't know if you should bring this up or not, but we're talking TMJ today. But one of your patients, Robert, said, I tuned you in. You did my dental implants 2 years ago, and it was the best experience of my life. I had to put that in there.
That's awesome.
Yeah.
I wish I knew what Robert that was. That's great.
Yeah, you know what? You never know who's watching.
That's right. That's exactly right.
We're not talking about dental implants, but one of your patients that you did work on. And what a great compliment, huh?
Yeah, absolutely. It's always good to hear the positive things for sure.
Yes. So what causes the jaw to make that popping, that clicking noise, like when you open or close your mouth?
Yeah, well, I guess the best way to start that off is just really, we got to talk about joints in general. No joints like compression. They all want room to move around. They want to be decompressed. When they compress, you feel the ligaments, the muscles, the tendons, the blood vessels, they all compress, and that causes inflammation and jaw pain. When we're talking about jaw specifically, you can have acute pain or chronic pain. Acute pain really comes like an accident, like somebody has a sports injury or a car wreck. But it's the chronic pain that we're really most worried about with TMJ, because the acute phases you can heal. But the chronic things, those are things that we're doing that we might have a habit, or it might be something that we're doing routinely that causes the compression, mostly like clenching or grinding your teeth. If you clench and grind, it can be developmental, which means that some people's upper jaw is not developed properly or widely enough to accommodate the lower jaw, and it gets constricted. Certainly, allergies are a big part. Arthritis can play a big part, and then the posture we talked about. But I think when you think about the clenching and grinding, that is probably the thing that is most talked about that causes TMJ problems, and I do believe that's probably true. But clenching and grinding are two incredibly different things, Steve. And when you think about this, clenchers usually are those people that have stress and anxiety. And as a result, what they do is they just keep their teeth together a lot with tension. They can have perfect looking teeth, but they just have their teeth together a lot. People that have that are grinders, you got to think of muscle now, okay? Muscles want to have a resting length. And if you think of a muscle being calm in this area, their resting length, they don't want to be stretched and they don't want to be foreshortened, because that causes tension, trismus, spasms, pain, and all that kind of stuff in the muscle. So the brain's going to send if we put our teeth together and putting our teeth together in a habitual manner causes foreshortening of our muscles, then our brain's going to send a signal. It's going to say, hey, we don't like that position. So what we got to do is we got to move our jaw to find that position, causing grinding. Okay. So that's a big deal. But as far as the pops and clicks, I think I'm going to affectionately bring up Frankie, that this is something that my assistant has named, Lita. This is Frankie to my patients. But what I'm going to do is, if you can kind of see this, This is a TMJ joint, okay?
Okay.
And on what causes the pops or clicks, you can imagine right on the top here, we have a fossa that is the upper jaw that doesn't move. And then we have the lower jaw, which is the condyle that does move. On top of that lower jaw, we're going to have something called an articular disc that serves as a cushion between the jaws. And if we have a lot of compression right here, the disc cannot sit on top of the lower jaw. And as a result, it'll sometimes fall forward in this area. So when the disc falls up here, we hear it click off or click back on the joint. And so as we open, we'll sometimes see the disc click on. And as we close, it'll click back off. And so if that makes sense, that's really in a nutshell how that works. Yeah, so that's what causes that sound. It's interesting, isn't it?
Well, I mean, speaking of assistants, I got to say this. You have the best assistant in Sherry.
She runs my office, and Sherry is great. She's been with me for 30 years, if you can believe that. We've got a long history together, and she is awesome.
She's like your agent. She gets so excited when she talks about your practice.
Yeah, she's more excited than I am. She really loves it.
Yes, she is really good. Last night, we did a show in Atlanta on tongue thrust.
Sure.
And it kind of sounds like what we were talking about last night. Do you deal in that also?
Absolutely. And I want to tell you, that is a really commonly overlooked thing with this whole thing.